Hi, it's Dr. Lewis Clark. First of all, I want to thank you for allowing us to be your chiropractor and to help you in your knee pain recovery. This video is designed to help you to know how to take care of yourself at home and how to properly stretch and strengthen the most important muscles that supports your knee. Okay, so I'm going to go through the most important, I believe, muscle, or most neglected at least muscle in the knee, which is the popliteus. This is a very small muscle that is on the back of the knee, starts on the outside of the knee, wraps around to the inside. It has two main jobs. Number one is to initiate flexion of the knee. And its other main job is to keep the tibia, the lower leg, lined up with the femur. So this muscle is very small, about the size of my finger in most patients. So therefore, it gets overpowered a lot of times by the other muscles, and then therefore gets weak, or sometimes it gets injured, and then it can't do its job, and the knee is unstable. And it's never, ever hardly checked in a typical knee exam. So this is something we test. If you have a weakness in this area, let me show you how to fix it, okay? So the first exercise is a strengthening exercise for the popliteus. This exercise is done with you sitting, and I'm actually going to move to the stool here. So the knee gets to about 90 degrees bent, and you take your foot, turn your toe all the way out, and then rotate your toe in with keeping downward pressure on the ball of your foot. Now let me show you. This is correct. Watch this. That's the correct way. This is not correct. Do you see what happened there? When the foot comes up and turns in, I just started using a different muscle. That is not correct. The correct way, the foot should stay flat, and as you press down with a rubber shoe, on carpet especially, you get good resistance rotating the foot in. This exercises the popliteus muscle in the back of the knee. You should be doing at least 10 of these 3 times a day, and work up to the point where you can do 25 3 times a day. And you can progress with this by then putting a weight on the ground and then putting additional pressure on the popliteus by pushing a weight in addition to the foot on the floor. Okay. Now, very, very, very important. The upper part of the knee. These muscles up here cannot move at all. This movement is done only in the lower leg. Only the foot and lower leg move, not the upper part. Okay. That's the popliteus strengthened. Now, it's also a hard muscle to stretch. So let me show you a tip here for stretching your hamstrings to include the popliteus. All right. So when you do a hamstring stretch, most of the time you put the leg up on something, then you bend over and like you try to reach and touch your toes. Okay. And this is a great hamstring stretch, by the way. Okay. But to include the popliteus, you're going to rotate your toe out. Let me move around so you can see this. Okay. So instead of stretching with my toe straight up, I'm going to rotate my toe out, and now I'm going to lean into this, and the difference you will feel is in the back of the knee. Now, you're still getting a hamstring stretch, which is needed, but you're feeling that pressure now in the back part of the knee more. So you're getting a little bit of a hamstring as well as a popliteal stretch here doing this. You involve both, okay? So a little bit of difference. Now, if you're not stable, guess what? You can do this sitting. So again, rotate out, and then I bend down, and I reach for my toe, and I feel it in the back of the knee, okay? If you want to stand, but you're not real stable, then you grab a chair, and again, you can either prop this up, like Dr. Carroll had a great idea. If you have stairs in your house, you can put it up on a stair or two. If you have a stool or a chair or something that's not too high, you can do the same thing. You can have another chair here to stabilize you so that you're stable. All right? So there's the two for the popliteus. All right? Now I'm going to have Dr. Carroll. He's got an amazing protocol for working the vastus medialis, what's called the VMO muscle on the inside of the quadricep, So Dr. Stephen Carroll, come on over here and demonstrate and show us the progression here and take care of the VMO.
Okay. So the Journal of Rehabilitation states that the VMO muscle is one of the most crucial muscles to help stabilize in the inner knee. A lot of people come into this practice and they have inner knee pain, and when we take x-rays, we tend to see a little bit more degeneration right there. That's because the VMO muscle is not engaged enough and not protecting and supporting the knee. So I'm going to show you a progression from baby steps forward. If you can't do the very first step, it's going to be difficult to do these other things. Okay, so the first one, if you have a little ball, it doesn't have to be very firm. I'm looking for something to put right here between the inner part of the knee. Here's the bone. You want to be a little bit above it, from here to right about here. Okay, so I'm going to use this volleyball here. It's got a little bit of a give. What you do is, actually, I'm going to grab this chair right here for a second.
So a basketball would be too big.
A basketball's too big.
But a volleyball, a soccer ball, even a kickball or anything
even
like
a
that,
little
kids'
football.
little ball, football, that would work.
Yes, sir. So you want to get in a chair that doesn't lean back and you're not kind of scooting forward. You want your back to be straight when you do this. The ball, again, it's not at the bony part of the knee right here. You want to put it in the meaty part, about an inch or two above this inner knee, okay? You're going to squeeze the knee. By squeezing it, you're contracting this muscle, and you're going to elevate the leg. Now, functionally, if you can't do this exercise for about 2 to 3 minutes with your legs fully extended, functionally, it's weak, and you need to develop and strengthen this muscle. So this is starting point number 1, okay? See how I'm kind of shaking a little bit? If I'm shaking, it typically means that my muscle's weak, and it's trying to deal with the stress. So it's a sign that you need to develop that muscle, okay? So build yourself up to 2 minutes. When you can do 2 minutes, the next progression is you're going to stand up, and this is called mini squats, okay? So instead of doing a fully engaged squat, you're going to use the ball. Again, you're going to put it right here between the knees, okay? Your feet shoulder width apart. You're going to look forward. Imagine you got a balloon holding your head up high, so you got good posture when you do this. And you're only going to bend down maybe about 30 degrees. By doing that, you're squeezing the ball against the VMO muscle, and it's engaging it more, okay? And you just do about 2 sets of 15 reps, and you do those twice a day for me. By doing that, what you're doing is you're engaging these muscles a lot more, and then you're going to get stronger, and the knee's going to have a lot more support. And like I said, the Journal of Rehabilitation states that the VMO muscle is one of the most crucial muscles for supporting and protecting the inner knee, okay? When you can do the mini squats without the ball, or when you can do the mini squats and there's no pain, and you're just getting a lot stronger, the next progression is to do an actual squat. Arms out in front of you, feet shoulder width apart. And this is where I want you to pay close attention. I'm going to demonstrate on this right knee so you can see what not to do, okay? When you squat, if your outer quad muscles is still strong and you're not engaging this inner knee, that knee will shift outward. So when I do this, it should look just like this, but it should not look like that. If I'm going outward, I'm engaging these outer quads and not these inner quads enough. So you try to keep your legs and your knees going straight like this, okay? That's why we're using the ball in between the knees to do mini squats, to kind of get you used to and train and engaging that muscle more. Because when you progress to the full squats, if you're going out this way, it's still too weak, okay? If that's the case, continue back on the mini squats. Another great stretch I'm going to show is, I'm going to use Dr. Clark here for a second. Going off of that, if my outer quads are too tight, my IT band is typically pulling my hips and my knees out of place. So I'm going to show a fantastic stretch to stretch the IT band. Doc, if you don't mind laying down on your right side. So there's a lot of stretches out there, but I like this one better because it's a 2-man approach to really stretching this muscle. What you do, you have them lay down on their side, and you want to keep their legs straight. I come out in front of them. You can do this on a mattress, or you can do this on a bed. What you're going to do, there's a bone right here Okay, if you slide your hand down from your butt down the side, you should feel a big bone right there. You're going to use the palm of your hand to contact it, and then you're going to very slowly push downward. I'm not jerking it, I'm not rubbing it down. It helps to stretch from here all the way up to help release that tension so that my knees don't go out to the side. And you want to hold for about 10-15 seconds, come back, and then do it again about 2 more times. And that'll help stretch that muscle out. Okay?
That's a great stretch, and that feels really good. If you've got somebody that at your house that can work with you on that, that's a home run. Now, if you don't, Dr. Carroll, do you have another idea what they can do for the IT band to help if they're by themselves?
I do. There's a lot of products out on the market. This is a very cheap one. I bought this at Walmart for $8. Okay? What you would do, you would turn your hips to the side, and you would just roll it out. It breaks up the scar tissue, it elongates the muscle fibers, basically making it where it's not tight and pulling your knees out this direction, allowing these inner VMO muscles to be engaged a little bit more.
Excellent, Doc, I appreciate that. So, some people are not going to progress, obviously, to that full squat thing that Dr. Carroll did, okay? But the whole thing is there's something here that everybody can do. And so work up as far as you can. Now, the last thing that I'm going to talk about are the hip flexors, in particular the psoas muscle, okay? A lot of people exclude the psoas as being a component or a part of the problem with the knee because it doesn't actually cross the knee. It only goes from the lower back to the hips, to the upper leg, the femur. However, the psoas has a big involvement in the knee in 2 ways. Number one, because it affects the lumbar spine. If your psoas muscle is tight, it will pull your spine forward and to the side of tightness. So your hips roll forward and your spine is pulled sideways because of the tightness here, which can interfere with nerves, and there are 2 critical nerves to the knee. One comes out at the L4, L5 area, and the other right above it at the L3, L4. And that's for the VMO muscle that Dr. Carroll talked about and the Popliteus muscle in the back that I talked about. So psoas is critical. I'm going to show you how to stretch this psoas muscle, okay? And basically, it's like a 1 foot forward, okay? And this leg bends, and I'm going to turn the other way so you can see the actual leg I'm working on. The front leg bends, the back leg stays straight. And my body needs to be upright, okay? So this right here, again, I've got the table over here for stability. If I need to do it with a chair, I can use a chair on the side to help me, and I can feel this stretch right here. Now, that's a great way to stretch the hip flexor, all right? But not everybody can take the pressure on. Maybe they got 2 bad knees, okay? So if that's the case, I'm going to show you an easier way to do it. And that is with you laying on your stomach. You're going to do like you're going to do a push-up, but you're going to leave your hips on the ground and extend up as far as you can. And even if you can do the other, this is a great lower back stretch because we spend so much of our time bending over that we forget that we also need to go backwards, all right? So, that's the psoas, the hip flexor, needs to be stretched. Dr. Carroll did a great job on showing us the iliotibial band and the tensor fasciolatum muscle that goes down the outside of the knee. He also showed us the medial vastus medialis, the VMO, in the medial knee, inside knee, and then we worked on the popliteus across the back. If you work on those 4 muscles, you're going to have a stronger knee than what we would have had without it. So remember, 50% of your improvement comes from the things we do here. 50% comes from your home exercises, your nutritional changes, dietary changes you're making, and your nutritional supplementation. So, God bless, live life well, see you at the office.